Hello.
Hello, how are you?
Hi, I'm good. My name's Marla. I'm one of the nurses here. What's your name?
Escania.
Okay, let me check your wristband. Can you tell me your birthday?
October 8th, 1985.
Okay, and you're here for the head and neck assessment?
Yes, ma'am.
Okay, let me wash my hands.
Okay.
I'm going to be doing your assessment. I'm going to be touching your, throughout the assessment I'll be asking questions.
Okay.
And I'm going to be touching your scalp and your face and your neck.
Okay.
And I'm going to ask questions as I do your assessment.
Okay.
Have you or anybody in your family ever had any problems with your scalp?
No, ma'am.
Okay. Have you or anybody in your family ever had any problems with your skull, face, trachea, or thyroid?
No, ma'am.
Lymph nodes?
No, ma'am.
Have you ever been diagnosed with an illness affecting your head, face, or neck?
No, ma'am.
Do you now or have you ever had an infection affecting your head, face, or neck?
No, ma'am.
Have you had any problem with your thyroid?
No.
Describe any recent or past injuries to your head. Have you had any?
No, ma'am.
Okay. Okay, I'm going to inspect your head and your scalp. Look down for me, toward me, and I'm going to look at your scalp. I'm looking for nodules, lesions, and I'm looking at the integrity of your skin. I don't see any scaling or flakiness or anything like that. There's no nodules or anything. There's no lesions or anything like that, so your scalp looks good.
Okay.
I'm also going to palpate your skull, frontal lobe, occipital lobe, temporal lobe, parietal lobe. It's all symmetrical. It all looks really good. Do you have headaches?
No, ma'am.
Okay. The size and shape of your head looks good. Everything is symmetrical. There's no lesions or foreign bodies. Your facial expression looks good. That your eyes, ears, and nose and mouth are all symmetrically placed. All your movements are smooth and with purpose. Okay, now I'm going to palpate your temporal artery right here, which feels good. It's flat. And now I'm going to listen to it through my stethoscope.
Okay.
And I'm listening for any sounds that shouldn't be there. Sound called a bruit. And yours sounds good. Okay. Open your mouth as wide as you can. And close. Do it again for me. Okay. That looks good. I was checking the range of motion of your temporomandibular joint there.
Okay.
Now I'm going to be looking at your neck. Look forward. It looks good to me. There's no swellings. Everything is symmetrical. There's no swelling underneath your jaw here. Your trachea is midline to both sternocleidomastoid muscles. I'm going to palpate for your lymph nodes real quick. In front, you've got some back here. You've got some underneath the jaw here, right here. You've got some here, and you've got some here, and you've got some here as well. Okay, everything looks good. All right, now I'm going to palpate your trachea. I'm going to move up here. I can feel the C-rings in your trachea. Okay. Now I'm going to push up a little bit. I'm going to feel the hyoid bone. I'm going to ask you to swallow. Okay. Okay. Swallow again for me. Okay. That's good. Okay. I'm just going to touch your thyroid. I'm going to push it to the left. Swallow for me. If you can't, just no. Okay, push it to the right. Now swallow. Okay, very good. Okay. Now I'm going to test the range of motion of your neck. I'm going to get you to look down, put your chin next to your chest real slow and back up. Turn to your right, turn to your left, and then back. Very good. Okay. Okay, have you had any problems with your vision here recently?
No, ma'am.
Okay. What was the date of your last eye exam?
Around September this year.
Okay, and do you wear glasses or contacts?
No, ma'am.
Was your vision 20/20 at your assessment? Okay.
Yes, ma'am.
Have you or any member of your family ever been diagnosed with hypertension, diabetes, or glaucoma?
No, ma'am.
Okay. Have you ever been diagnosed with a disease of the eye?
No, ma'am.
Have you ever had an infection of the eye?
No, ma'am.
Any injury?
No.
Surgery?
No.
Okay. I'm going to test your distance vision. There's a chart
Okay.
on the wall over here. It's called a Snelling chart. I'm going to get you to place this over one eye.
Okay.
And I'm going to get you to read the chart starting at the top. Read all the way down from left, every line from left to right, all the way down to the smallest line that you can read.
Okay. Okay. E F P T O Z L P E D F E C F D E D F C Z P.
Okay. Cover your other eye and do the same. It's okay. You're doing
Okay.
really well.
E F P T O Z L P E D P E C F D E D F C Z P.
Very good. Okay. Now read it with both eyes.
Okay. E F P T O Z L P E D P E C F D E D F C Z P.
Okay, very good. Now I'm going to test for your near vision. I'm going to get you to hold this right there.
Okay.
Actually, you can hold it here.
Okay.
And I'm going to get you to cover one eye and read this just as you did the one on the wall.
Okay. E H N D F N P T X Z U Z D T F.
Okay, cover your other eye and do the same.
Okay. E H N D F N P T X Z U Z D T F.
Okay, uncover that eye and read with both.
Okay. E H N D F N P T X Z U Z D T F.
Okay, very good. Okay, I'm going to get you to hang on to this and I'm going to get
Okay.
you to cover your right eye. I'm going to do the same. I'm going to cover my right eye. And as soon as you see my pen light, I want you to say now. What this is doing is testing for your peripheral vision.
Okay.
Okay? Ready? Go.
Now.
Okay.
Now.
Okay.
Now.
Okay.
Now.
Okay, cover your other eye. We're going to do the same.
Okay.
Ready? Go.
Now. 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 Now.
Okay. That looks good. All right. I'm going to test the 6 cardinal fields of gaze. This is
Okay.
my pen light. I just want you to follow the tip of my pen light.
Okay.
Okay? Okay. Very good. Okay. Now I'm going to assess the corneal light reflex. I'm going to shine a light in your eyes, and as I just want you to stay focused on the wall while I shine this light in your eyes, and the reflection in both of your pupils are exactly the same. Okay? Now the test that I'm about to do, this test determines the balance mechanism, and this is what helps keep your eyes parallel. I'm going to get you to look at a fixed point on the wall.
Okay.
Okay. Now I'm going to move the card after I cover your eye, but I want you to keep your gaze fixed on the wall.
Okay.
Okay? Ready? Okay. Okay, very good. All right, now I'm going to inspect your pupils. I'm going to be looking to assess the size and the shape of the pupils, okay?
Okay.
Now, just gaze at the wall and keep your gaze. Your pupils look really good. They're both equally round and reactive to light accommodation. Okay. Okay, I'm going to test for accommodation of 2. This is going to be testing the muscles of the eye. I'm going to ask you to gaze at the wall, like say one spot on the wall, and then when I count to 3, I want you to shift your gaze to the tip of my pen. 1, 2, 3. Very good. Okay. Now, I'm going to do the corneal reflex. I'm going to test for your reflex. I just want you to look straight forward at the wall,
Okay.
and I'm going to wisp this by your cornea, okay? Very good. Just testing your reflexes there,
Okay.
that's all that does. Okay, now I'm going to examine your conjunctiva. Let me put a pair of gloves on real quick.
Okay.
So are you ready for Christmas?
Yeah, I'm just done with all my Christmas shopping.
That's good. It's right around the corner, isn't it? Okay, I'm going to get you just to gaze at the wall.
Okay.
I'm going to pull your eye apart. I'm looking at your conjunctiva. Look up for me. Look down. Very good. Everything looks really good. I'm going to do the same on this one. Look up for me. Look down. Okay. The conjunctiva looks good. There's no lesions. There's no swelling or anything like that. And everything is pink and moist. Okay. What I'm going to do now, I'm going to use this and I'm going to pull your eyelid forward and I'm going to inspect the inside of your eyelid. Okay. Okay. That looks really good. There's no lesions. That looks good. No lesions, no swelling, no drainage, or no tenderness or anything like that. Okay. Now I'm going to use the ophthalmoscope.
Okay.
I'm going to use this to look in the retina of your eye. Okay. Now let's see. If I wasn't so short. You ain't put them back out yet. You can put them on the board. Okay, there we go. Okay. Okay, looks good.
Okay.
Okay. Now this, I'm going to look at the sclera of your eye. And the cornea, just gaze at the wall for me. I'm going to look up from the side here. Your sclera looks good. Your cornea looks good. It's clear. The sclera is white. Now I'm going to do the same on your right eye. Good. Looks really good. Okay, I'm going to ask you to close your eyes for me. Just look straight. Okay. Your eyebrows look good. They're symmetrical. Everything is symmetrical. I'm just going to palpate your eyes. The eyeball is firm. Looks good. There's no indentions and then there's no protrusions there either, so that looks really good. And there was no tenderness, right?
No.
Okay. Okay, have you had any problems with your hearing?
No,
Have you
ma'am.
noticed any changes in your hearing in the past several months?
Mm-mm.
When was your last hearing test?
Around September.
Have you ever been diagnosed with a disease affecting the ears?
No, ma'am.
Do you now or have you ever had an ear infection?
No, ma'am.
How about drainage?
Mm-mm.
Okay, any dizziness, nausea, vomiting, or ringing in your ears?
No.
Okay. Any pain in your ears?
No, ma'am.
Oh, good. Okay, what I'm going to be doing, I'm going to be touching around your ear area.
Okay.
Okay, if you feel any tenderness or pain, let me know and we'll stop this part of the exam.
Okay.
Okay, so I'm just going to push around here. I'm looking at your ears. I'm looking for the size, the symmetry. It looks good. The skin looks good. There's no breaks or lesions. There's no drainage or anything. And I'm just going to palpate to make sure there's no nodules and to make sure you don't have any tenderness areas. The auricle looks good. It's soft. I'm going to push on your tragus right there, and it's flexible. It looks good. It's firm. Everything looks good. I don't see any foreign bodies. But I'm going to grab the otoscope, and I'm going to take a look inside. Okay. That looks good. I can see in pretty good. There's no drainage, there's no foreign bodies, there's no redness, there's no swelling. I can see the tympanic membrane. It's clear. It has no patches or lesions or anything like that on it. It looks really good. Okay. Have you noticed any problems? Have you had any problems with your nose or sinuses?
No, ma'am.
Are you able to breathe through your nose?
Mm-hmm.
Do you have nasal discharge?
No,
Do
ma'am.
you have any nosebleeds?
No, ma'am.
Have you ever had any nose injury or nose surgery?
No, ma'am. Okay,
well, you're just healthy as can be. Have you noticed any changes in the past few months with your mouth or your teeth?
No, ma'am.
Do you have any problems swallowing?
No.
Do you have any sores or lesions in your mouth or tongue?
No, ma'am.
Do your gums bleed frequently?
No, ma'am.
Have you noticed a change in your sense of taste recently?
No, ma'am.
Do you have any dental problems or have you had any problems or surgeries?
Mm-mm.
Do you wear any permanent or removable appliance?
No, ma'am.
How often do you brush your teeth?
About 3 times a day.
Good. Do you floss?
Yes, ma'am.
Okay, and when was your last dental exam?
Around September of this year.
Very good. Okay. Okay, I'm going to be pressing on your nose a little bit. First of all, I'm looking at it to see the symmetry, and it's right where it should be, sitting symmetrical on your face. There's no broken skin, there's no lesions, there's no drainage, and I'm just going to press on it to see if you have any tenderness or anything like that, or to make sure it's stable. Okay, what I'm going to do, I'm going to push on one side of your nose. Can you breathe? Good. Again? Very good. Okay. So your nose is patent, there's no tenderness, there's no swelling or anything like that. Now I'm going to palpate your sinuses. Now let me know if there's any tenderness. Here. Okay, now I'm going to use my finger. Okay, no tenderness or anything like that?
Mm-mm.
Good. Okay, now I'm going to look in your mouth. First,
Okay.
I just want you to smile at me and show me those pretty teeth. They're beautiful. They're white. Do you brighten them with something?
Sometimes.
Okay, does that make your teeth sensitive or anything afterward?
No, ma'am.
No? What do you use? Something from the dentist or something
From over the counter.
over the counter? Well, it works really, really well. Okay, open up wide for me, and I'm going to look at the inside of your... Let me get a tongue blade.
Okay.
Let's see. Okay, I'm just going to use this tongue blade so I can see inside your mouth, your mucous membranes. Your teeth look really good. The sides of your mouth look really good. The roof of your mouth looks good. Can you touch the roof of the mouth with the tip of your tongue? Very good. Okay, and I can see both Wharton's and Stinson's ducts are visible. Okay, open your mouth for me. I'm going to press down your tongue a little bit. Say ah. Okay, your uvula is midline centered, and it does come up when you say ah. And you still have your tonsils, and they look good. Okay, and both sides, the pharynx and your throat looks pink and moist. And there's no swelling or no lesions. Everything looks good. That's it. Thank you.
you.
You were such a good patient.
Thank you.